Nurses are truly remarkable. If you are a nurse, God bless you, because you take on a role of a compassionate leader and someone that we can rely on emotionally and someone that we confide in. Mm-hmm. And you are someone that we trust completely because you've taught us everything and you know everything that helps us. So having a PD nurse is just wonderful. Like, Terry is always, what's going on? Mm-hmm. What's new with you? Mm-hmm. Let me get you this, let me get you this. Are you good at this? I feel like she's my medical mother. My PD nurse, who I've spent the most time with, has become a dear friend to me. Her name is Terry. If you're watching this, hello. She is hilarious. I would be very, very sad if she ever decided to transfer somewhere else, or if she was moved somewhere else. I feel like I'd be honestly losing an important person in my life. And I think that says a lot about nursing.
I had a nurse in the very beginning. His name was Matt, and he said a phrase to me that I'll never forget. He always said, dialysis, it's like a part-time job, and because you're here 4 hours a day, 3 days a week, so it does. It does feel like a part-time job sometimes.
All right, perfect. Going to be around today. Part of the conversation. How are you?
I've known Candy from the very beginning. You see him so much and you spend so much time with him. You trust him and you talk about personal lives and things that go on from day to day. Holidays, birthdays, stuff like that. And you trust them to watch over you because if your blood pressure drops, that's really bad.
How was your St. Patty's Day?
I went out and bought you ever seen the St. Patty's Day lace?
No.
I was going to wear it Saturday, but I'm not going to.
The practice of nephrology nursing I really see as nursing in its purest form. The autonomy that is allowed in a freestanding dialysis clinic. Yes, there's a medical director, but it's nurses and patient care technicians that are there at 4:30 in the morning to start getting patients on. The registered nurses are the ones that are assessing, deciding, does somebody need to be called about this? Are we okay to put the patient on? You gotta have your head on straight and you need to be thinking, and this is nursing in its care. And then as well as getting that patient comfortable, having them feel safe and knowing that you're there for them, building that trust. Hey Carlos, how are you doing today?
Good.
Good. Here, let me take a little listen to you here.
Okay.
How are you feeling?
I feel great.
Okay, any headaches?
No.
And your access, any pain, any difficulty?
No.
I've been a registered nurse for 34 years. I've been a nephrology nurse practitioner for 18 of those 34 years. The kidney is really the body's greatest organ. I mean, you can cut it out, put it in an igloo cooler, hook it back up again, and it starts making urine. I mean, how cool is that? So I love the physiology of it. I love to continue to learn. I love that we've expanded and looking, a heart-lung connection, a kidney-lung connection, a liver-lung connection, really how the whole body talks to each other and how the kidney plays into that.
We have patients that are chronic, of course, and they are with us for the majority of them for a long time. So we have that connection with the patient. So that's one of the things that I enjoy the most.
There is a beauty in being able to care for a person and their family for months, years, decades. You see them through those times in their life. They see you through your marriages, divorces, pregnancies, grandchildren. It's impossible not to share. It's just how this profession is. What I love most about home visits is that you get to see how treatments, how renal replacement therapy really works in this environment. Hi, welcome. Hey, Kelsie, good to see you. How are you doing, sweetie? Good. Give me a hug.
It started affecting me when I was 14 years old. It was determined that I was in kidney failure, and at that time I had, they said, probably 24 to 48 hours and I wouldn't have made it. It's difficult and it's not fair that especially a child would have to experience that. When I got my transplant after the 9 months, it was not the transition that I had hoped for. We were unaware of the massive amount of medication that I would need. I went to school and I went to college and I was going to church functions and met so many friends and someone that I ended up marrying. When I had my second child, my little girl, it was a hard getting on after I had her. The fatigue was hitting me hard, and it was just because of the baby. It was just after all that, my body just doesn't know what to do. I woke up the next morning and it hit me. I was like, I am in kidney failure again. They tried rejuvenating it, if you will, with rounds of chemo to kill off whatever was attacking and breaking those fibers. But after probably a month, my doctor came to me and said, look, your kidney is pretty much done for. There's nothing we can do. I guess we move on to the next step, and that next step happened to be PD, and here we are.
Well, Kelsie, how are you doing? It's been about a month since I last saw you.
I am doing really well.
No fevers?
No fevers.
No chills?
No chills.
Shortness of breath?
A little bit.
And you're able to run around after your kids?
I am.
And keep up with them?
Yes.
The thing I love about her treatment is it's so perfect for her lifestyle, and she echoes that over and over again. And I think that because she's this mother, home hemo, no, plus she'd need a partner. In center, no, absolutely not. So peritoneal really worked well for her. She needed in-center training. She talked about her 40-hour week. She mastered her skills. I loved when she said she got home and she looked at the machine like she'd never seen it before. That is so common, and when I teach, I always say that you're gonna have that moment like you've never ever seen the machine before. You know, it's like taxi and takeoff. Once you hit your cruising altitude, there's going to be, every once in a while, there'll be a little turbulence. And she said every once in a while an alarm goes off, but for the most part, you're going to sail and it's going to be good. You just have to get there. And your nephrology nurse is going to help you get there, but she's always going to be with you once you're cruising.
You are one-on-one with a patient, and you are teaching and you are helping them learn specifics to make their life better. And my life is truly better. I live a wonderful life. My daughter went through some health issues and she was down at primaries, and we had to go to the outpatient building, and I saw pediatric dialysis, and I was like, oh my gosh. I cried. I was overwhelmed because those people changed my life. Mm-hmm. They made everything better.
What works for me is to continue to grow and to enhance and to never get bored, to always ask questions, respectfully ask questions, and to continue to push. So I think it would be tough to get bored in nephrology nursing. Truly, you get more than you give. You give yourselves to your patients, but in forming these relationships, these lifelong relationships, as well as just moving into the different facets of nephrology nursing, you just gain so much and so many more skills. That's what keeps me going. I need these patients because they feed me and I can help them. It's a collaboration like none other.